Hi, I'm Dr. Babak Larian, and I'm going to talk to you today about Zenker's diverticulum, how it develops, the symptoms it gives you, and the laser surgery to manage and take care of it. I'd like to first start by giving you details of the anatomy of the throat, and then moving on to explaining how swallowing happens, because it's a very complicated process. The anatomy of the throat starts by looking at the tongue, then down to the voice box and the breathing tube, and then lastly you can see the esophagus, which is right behind it. At the top of the breathing tube, where the voice box sits, is where the muscle cricopharyngeus wraps around the esophagus. This muscle is the muscle that closes the esophagus and prevents food from coming up from your stomach into the throat area. If you have long-lasting acid problems or any neurologic issues that affect that muscle, that can cause the muscle to not relax during swallowing, and that's what leads to the Zenker's diverticulum developing. Swallowing is a very complicated process, and the reason for that is that the breathing tube and the swallowing tube are right next to each other, and when the food gets into the throat, it has a choice of going into the breathing tube or in the esophagus and down to the stomach. What controls this is the voice box. The voice box right here has a mechanism by which it feels when the food is coming, it closes itself off, and then the muscle cricopharyngeus, which wraps around the upper part of the esophagus, relaxes, opens, and the food goes down to the stomach. As you see here, the food is in a green shape right in the front of the mouth over the tongue. The tongue pushes the food backwards, and when the food gets into the throat and right behind the tongue, that's when the whole mechanism starts of swallowing. That's when the triggers go on to help close the door of the breathing tube, which is this little door, and then relax the muscle, the cricopharyngeus or the upper esophageal sphincter, which allows the food to go down appropriately. And you can see this in this image. That door closes the breathing tube, the muscle relaxes right here, and the food goes down and passes all the way through down towards the stomach. When that happens, the muscle again contracts and closes to prevent the food from coming back up, and the door that closed the breathing tube opens up so you can breathe again. When this muscle doesn't relax, over time a pocket forms, and that pocket gets bigger and bigger as the throat squeezes to push the food down against the closed valve muscle. And once the pocket forms and is big enough, it can give you the area where food can get trapped and be held in place. As you see in the next image here, a diverticulum pocket right there is where the food gets trapped. And when we do the surgery, we remove this wall where the muscle sits in, causing all the problem. And when the wall is removed, the diverticulum pocket empties out into the rest of the esophagus and not catch in there. We start the transoral laser Zenker's diverticulum surgery by putting a scope through the mouth that goes down into the throat area. We see the lumen of the scope in this view. Up top you see the esophagus, and at the bottom is the pocket of the Zenker's diverticulum. In the middle is the band of muscle that serves as the valve to close the esophagus. This is called the cricopharyngeus muscle or upper esophageal sphincter. You see the pointer of the laser as a red dot over that muscle area. When we start the laser, it's very normal to produce some smoke, which we'll use suction to remove. Sometimes we have to use a grasper to pull the tissue apart so that we can see the muscle layers better, which you see in the screen. The laser is used to remove the muscle one layer at a time, so that we are sure to not cut too much or too little. And as you can see, the muscle pulls apart with each layer of lasering, falling apart and separating completely. Once all the muscle has separated, the laser portion of the procedure is completed. After that, we'll suture the mucosa that you see up top to the mucosa of the bottom, closing the wound, and that ends the procedure. Once completed, we'll remove the instrumentation, and the patient is taken to the recovery room. They'll have to be on a liquid diet for 1 week after surgery, and a soft diet for a week after that, and at the 2-week mark they'll start on a regular diet. Patients stay in the hospital overnight and can go home the following morning after they have a liquid breakfast.